So SCOPE was founded almost 20 years ago as a European network for the management of transplant patients with dermatological problems. So it's actually skin care in organ transplant patient Europe. And we focus on issues concerning skin tumors, cancers, melanomas, etc. In this patient group.
The presentations in the SCOPE meetings are on different tumor types in organ transplant recipients, namely melanoma, Merkel cell carcinoma, but also metastatic squamous cell carcinoma. And I think the theme is quite repetitive across all these tumor types, that you have a higher frequency of these tumors, but also if those tumors metastasize, the prognosis is worse than it is in immunocompetent patients. And then we also have the problem that a lot of the successful new therapies are actually working by activating the immune system. So actually they counteract the role of the immunosuppression that you need in these patients after transplantation. And in the moment we have case reports in single patients that have been treated with these diseases, and we see that with some treatments like the PD-1 antibodies, we probably see organ rejection rates of around 50% if we use them. So it's not an easy decision, and it's something where a lot more data collection would be necessary to better understand which patients are predisposed to have an organ rejection, and where maybe there are some markers that would help you to discern that. And I think what was very interesting for me is that SCOPE now already started a database collecting Merkel cell carcinoma patients in organ transplant recipients. And I think databases like this also for other tumor types, or maybe across all of these tumor types, would be very, very important to better understand this very, very difficult manageable population.
And we were very happy to have a satellite symposium within the frame of EADO. I would also like to stress that we have another slot on Friday morning, which is dedicated to skin cancer, squamous cell carcinomas in the scenario of immunosuppression.